Opening a lab report to find a number highlighted in bright red can be a stressful experience. It's natural for the first reaction to be a feeling of dread. Your blood test provides a detailed window into your body's internal environment. Much like a dashboard diagnostic, it provides specific data points for your doctor. Laboratories use data from thousands of healthy people to create a bell curve. This middle section represents the reference range, where about 95% of the population falls. Those results on the far edges are often mathematical outliers, rather than an immediate sign of a physical crisis. These acceptable ranges also change depending on your age and sex, and they can even vary between different laboratories. A result that sits slightly outside that center window is simply a starting point for your doctor to take a closer look at how your system is functioning. To get the most accurate snapshot of your health, you need to arrive at the laboratory under specific conditions. This often means being rested and following your doctor's specific guidance on medications. Most tests require an 8 to 12-hour fast. This is because a recent meal temporarily changes the levels of sugar and fats in your bloodstream, which can produce a misleading result. Staying hydrated by drinking plenty of water is also helpful. It keeps more fluid in your veins, making the collection process easier for the technician. If the procedure makes you feel uneasy, try looking away, focusing on your breathing, or listening to music to stay relaxed. When you prepare correctly, you remove the noise from the data, ensuring your doctor gets a clear look at your body's baseline state. On a complete blood count, your red blood cells act as the delivery system. They carry the oxygen that fuels every organ in your body. If your cell count drops, your body struggles to transport oxygen. This often leads to physical symptoms like fatigue, dizziness, or shortness of breath. Doctors also check MCV, which tracks the physical size of your red blood cells. Cells smaller than average often indicate an iron deficiency, while unusually large cells suggest a lack of vitamins like B12 or folate. By looking at the number of cells and their physical size together, your doctor can determine if your energy is tied to iron stores or vitamin levels. Your white blood cells function as the body's security force, activating whenever they detect an infection or inflammation. A differential test breaks these cells down into specialized squads. Some specifically target viruses, others respond to bacteria or even allergies. Then you have platelets. These are the specialized cells responsible for physical repairs and clotting. When you have an injury, platelets rush to the site and begin sticking together to form a seal, preventing further bleeding. Tracking these different cell squads and your platelet levels shows your doctor whether your body is currently fighting an intruder or repairing a physical leak. Beyond individual cells, we check the control center, the thyroid gland, located here at the base of your neck. Your thyroid sets the pace for your entire system, influencing your heart rate, your body temperature, and how quickly you burn energy. To monitor it, doctors check TSH, or thyroid-stimulating hormone. This signal actually comes from your brain, acting as an instruction to the thyroid. When underactive, the brain sends a heavy TSH signal to force it to work harder. But if the thyroid revs too fast, the brain shuts off the signal entirely. Thus, a low number indicates an overactive engine. Your TSH level reveals exactly how much effort your brain is putting in to keep your metabolism running at the correct speed. Notice how your red blood cell size reveals your iron levels, and your brain's TSH signal reveals your thyroid space. These markers work as a unified system, and tracking them over time helps you see long-term patterns in your health. Understanding how to prepare and how statistical ranges work helps you move from being a confused passenger to an informed driver. Having this knowledge helps you form a more effective partnership with your healthcare provider. You can now use your results to have a specific, detailed conversation about your well-being. The next time you receive your results, you'll be ready to bring your informed questions to your doctor and take an active role in keeping your engine running smoothly.